Hi. So my state was Tennessee, and there are a lot of different requirements. They've actually split it up into two different groups. So you can get an LPC, which is a licensed professional counselor, or you can get an LPC MHSP, which is a licensed professional counselor with mental health services provider designation. And so I'm going to go through both of those. So both of them have a requirement of getting the 60 graduate hours in counseling or a closely related field. And both of them have the supervised field experience of at least 500 clock hours of training, and then 300 hours of which is in a community health or mental health setting. But in order to diagnose disorders, which is that licensed counselor with mental health services provider designation, you have to have a minimum of 9 hours in coursework that's related to diagnosis, treatment, appraisal, and assessment of mental health disorders. There are, as far as postgraduate requirements, the requirements for both of them is that you have 2 years of professional experience. However, the LPC, you just need to get 1,000 hours of face time with professional counseling work, and then also 50 hours of consultations with an approved supervisor. However, the mental health services provider needs to get 2 years of professional experience with at least 1,500 hours of face-to-face time and 1,500 of clinically related work, with 150 hours in consultation with an approved supervisor, and that has to be in a clinical setting in which there are substantial opportunities for diagnosis of mental health disorders. Both of them must pass the National Clinical Mental Health Examination by the NBCC. However, the LPC MHSP must pass the National Counselor Examination as well as the Tennessee jurisprudence exam. The designations for the licensure title, as we already discussed, is LPC, which is licensed professional counselor, and the LPC MHSP, which is a licensed professional counselor with mental health services provider designation. There is a difference in as far as them being slightly tiered. You can get an LPC first, and then as you get more hours, you get the LPC MHSP, or you could just remain an LPC as well. The LPC cannot treat any mental, emotional, or adjustment disorders. They can only deal with marital problems, parent-child problems, antisocial problems, life circumstance issues, things like that. They can't deal with things that are of any mental health capacity, and they cannot assess or diagnose. Of course, the LPC MHSP can prevent, diagnose, and treat, but they cannot assess in a psychological nature. They can only assess in a non-psychological nature, and then they cannot prescribe medications, of course. And then they have to have, one of the differences in my states, they have to have letters of recommendation to show good moral character as well as a background check. That is also required, which of course is required for this course as well. I think one of the things that surprised me is just how limited the LPC really was in treating, not even treating, just doing anything with mental health disorders. It really surprised me that they weren't even, you're pretty much not even able to deal with any kind of mental health issue, and you have to give that to the LPC MHSP. So they're basically dealing with just everyday problems. And so you're kind of limited in that aspect, which would make it difficult to deal with everyday problems, because everyone has some kind of something that they're bringing to the table. However, if they have something that is a mental health disorder on top of those things, you have to refer them because you're not allowed to treat those